Hello, everybody. Good evening, and welcome to the Patient Education webinar sponsored by Medtronic and the National Association for Continence. NAFC is the largest and most prolific nonprofit consumer education and patient advocacy organization dedicated to bladder and bowel health. NAFC's key objectives are to destigmatize incontinence, promote preventive measures, motivate individuals to seek treatment, and provide collaborative advocacy for those who are affected by this problem. For more information and to receive their free newsletter or to join the community conversation, go to nafc.org. Our educational topic today is bladder control treatment options. We're so happy you could join us. Thank you. The online program consists of a 30-minute educational presentation followed by a Q&A session where your pre-submitted questions will be addressed by Dr. Scott McDermott. If you have a question you would like to submit, you can do so at any time during the broadcast using the Q&A widget located at the bottom of your screen. We may not have time to address all the questions during today's webinar, but we'll follow up with you to make sure you get the answers you need. Your screen is adjustable by moving the slide pane where it's comfortable for you. At this time, I'd like to introduce today's speaker, Dr. Scott McDermott. Dr. McDermott is a director of the Alliance Urology Specialist Bladder Control and Pelvic Pain Center in Greensboro, North Carolina. He completed fellowships in reconstructive urology and urodynamics at Duke University Medical Center in Durham, the University of Otago in Christchurch, New Zealand, and the University of Sheffield in England. Dr. McDermott's clinical, educational, and academic expertise is in male and female voiding dysfunction, neurogenic bladder, and complex lower urinary tract and pelvic floor reconstruction. He has lectured extensively on these topics. He's authored and co-authored numerous books and chapters and journal articles and is recognized nationwide as a leader in his field. We're so happy to have Dr. McDermott presenting today, and with that, I will turn it over to him.
Hello, folks. Thanks, Amy. My name is Dr. Scott McDermott. I'm calling in from Greensboro. Before I get started, again, I want to thank Medtronic and especially NASD for this educational forum. I really want to thank you folks for coming on and listening tonight. I'm sure you're busy. I have my daughter who's 12 and Andrew downstairs. We're going out to dinner after this. I guess you can call me a leaky bladder doc. I'm a urologist. I'm a subspecialist. Really all I do for a living is see men and women with voiding issues, and that's what we'll be talking about tonight. I've been in academics forever, but now I do my academics out of private practice. I just love to speak. I love to educate and talk to my colleagues and physicians, and it's really fun when you get a chance to talk to lay people like yourself, because it's really like talking to your patient. And really from my heart, I do hope this seminar tonight or this short forum is educational to you and hopefully motivates you to get help and set your goals high. And like I say, and improve your quality of life. So let's get going. The next slide, it really says how common are bladder control, these bladder control problems. Well, basically, millions of people have them. And in fact, there's a condition we're going to talk about, which is called overactive bladder. And 33 million Americans have it. That's a lot of folks. It's more common than diabetes. Go figure. I mean, diabetes is very common. It's much more common than Alzheimer's disease. And you may or may not realize this. I know we do have men on today. A lot of men have voiding dysfunction and overactive bladder and incontinence. And again, that's what we're talking about tonight, especially as they get a little bit older. Probably 30% or 40% of 30 and 40-year-olds have bladder troubles. It is really common, but the prevalence does increase as you get older, but it's not a normal consequence of aging. It just isn't, but it is common. The bottom line from this slide is that if you have bladder control problems, you're not alone, and please seek help. Now, we're going to talk about 3 bladder control problems. One is overactive bladder. That's what we're going to talk about mostly tonight, where you have the urgency and you have the frequency. You don't get there in time and you leak. And, of course, then there's a smaller subset of patients that have what we call retention. They have poor flow. They don't empty well. And because they're not emptying well, like a full glass of water, they can leak too. It kind of can spill over the side of the glass. Then there's patients with stress incontinence who leak with coughing, sneezing, bending. I'll come back to that on one more slide, but we're really not going to be addressing that tonight. You may say, Scott or Dr. McDermott, I kind of have, sounds like a lot of those problems. Well, you're what you call mixed incontinence. Most of my patients have mixed incontinence. They have urgency and overactive bladder leakage, but they also have leaking with coughing, sneezing, bending. I just want to take a moment and talk to you about what I call the balloon model. It's why people leak, and I've been telling people this since, I guess, 1994 or 1991, I think, actually, is that your bladder works like a balloon. The balloon fills and the stem is shut. When you want to urinate, the balloon contracts and the stem opens. There's 3 reasons women leak. One is bladder spasms. As the balloon fills up, it has a spasm whenever it wants, gives you urgency, you don't get there in time, you leak. That's overactive bladder. Then there's second reason women leak is they have a pelvic floor muscle. It's like a hammock. It holds up the balloon. My 2 hands are holding up right now in midair. It holds the balloon up. If those are weak, that pelvic floor muscle, when you cough or sneeze, the hammock drops, the balloon drops, the stem opens, you leak with coughing, sneezing. The third reason women leak is you can have a leaky stem. You can hold up a balloon, but the stem is loose, you still leak. So there's spasms, loss of bladder support, and or a leaky stem. There is a 4th cause, because I really said 3, but a smaller percent of people have that retention. They're having that overflow leakage like that full glass because they're not emptying well. Again, overactive bladder or urge incontinence, let me get to this next slide for you, I think it's the most bothersome symptom, at least my patients tell me with overactive bladder, because when you got to go, you're leaking before you get there. And it can be pretty high volume leakage at times. There are triggers for these bladder spasms, like running water. I call it the key in the door syndrome. Somehow your bladder knows you get in the driveway, there's the door, and you start leaking. And then the cold section in the supermarket, or what I call the foot on the floor syndrome, where the patient wakes up in the middle of the night, they're having a spasm, their feet hit the floor, and they leak all the way to the bathroom. That's all this syndrome. And a lot of these folks are voting many more than 8 times a day. 8 is normal. They're going very frequently because they're having spasms and urgency. And you say, can you sit through a 2-hour movie? Many of them can't. Okay, and it is affecting their quality of life. What about retention? A lot of these patients, men or women, will say, my flow's poor, I hesitate, I'm straining to urinate. I may or may not feel empty after. They sort of can lose their sensation that and they don't even know they're not emptying well, and then they can leak. When retention is severe, patients are actually treated with catheters. It's a small subset of patients, but in a true number in this country, it's actually quite a few, and that's why you see all those television ads that are selling catheters. These patients, there's millions of people that need catheters. They're just not really usually telling their neighbor or best friend that they have that problem. What about stress incontinence? It doesn't mean you leak when you're under stress like I am when I go to work many days. It means you're leaking. The stress is putting pressure on the top of the bladder, so you're pushing down on it. That's the stress. So you're leaking with coughing, sneezing, bending, exercise. And the last bullet on that slide is, whether it's stress incontinence, urge incontinence, or any type of incontinence, a lot of women or men with incontinence, they go to the bathroom more frequently. It's called time voiding, or they go on a schedule. They don't want to allow their bladder to get too full, because then they're going to leak either with an urge or with coughing. It's sort of they're trying to prevent the problem. Let's talk a little bit about anatomy. We're going to just mention the kidneys, ureter, and bladder. See those 2 cute little kidney beans? Those kidneys make the urine. The urine goes down the ureter tubes that transport them to the bladder. If you have a kidney stone, kidney stones don't hurt when they're in the kidney. It's when they get stuck in that ureter tube and they block it. And then we've already talked about the bladder like a balloon. What we're talking about today is not kidney problems. It's not kidney stones. It's not kidney cancer. These are bladder problems or problems with that balloon. Let's now go to a video, and it's going to talk a little bit about the nervous system and how the bladder and brain communicate, and why you can have some of these bladder symptoms that some of you may have listening today on the phone.
The central nervous system, the brain and nerves, control when and how often a person needs to urinate. In order for a person to urinate normally, the bladder muscle and the nervous system must communicate with each other through special types of nerves. When the bladder is full, one type of nerve tells the bladder to squeeze down and empty the urine. On the other hand, when the bladder is empty, this nerve is quiet so that the bladder can relax and fill up with urine. These nerves work by causing the muscles in the wall of the bladder to contract. When these muscles contract, the bladder becomes smaller and urine is emptied. A second type of nerve tells the nervous system that the bladder is filling up with urine and that it is time to urinate. A third kind of nerve tells the nervous system when the bladder is irritated by infection or other problems. Normally, these nerves are quiet because in a normal bladder, there isn't any irritation. Overactive bladder is a common problem that can cause people to have distressing symptoms, such as inability to hold urine, difficulty with emptying the bladder completely, frequent urination, or painful urination. It is believed that one possible cause of overactive bladder is that the nerves between the bladder and the nervous system are not communicating properly. The type of nerves that normally should be quiet may become turned on in many patients with overactive bladder. It is not known why this happens in some people. When these nerves are turned on, it tells the nervous system that the bladder is irritated, even though it's not, and the nervous system responds by telling the bladder muscles to contract so it can empty. This is what causes the distressing symptoms of overactive bladder, such as the urgent need to urinate, frequent urination, or losing control of urination. Therefore, it is important to understand that the cause of overactive bladder in most patients may actually be a problem with the nerves rather than a problem with the bladder itself. Doctors usually treat overactive bladder with medications. These medications help relax the muscles in the bladder. Relaxing the muscles in the bladder may reduce the symptoms of overactive bladder.
A lot of these things next, but that's really talking about, I'm going to come back to that in a little bit and talk about communication and the nervous system, what therapies can help you. So let's move on just for time. I'm going to ask some questions now that are really asking the audience or patient, is your bladder controlling your life? That's what these questions are really asking. Is that your bladder always on your mind? Are you doing what that second bullet? Are you doing what we call bathroom mapping, where you know where every restroom is in your community? Are you wearing pads? Are you stopping activities like traveling or going to the gym because of your incontinence and frequency and your lack of confidence with your bladder? Are you avoiding dating or going out with friends to dinner, again, because you don't have confidence in your bladder, or you're getting up several times at night and you feel exhausted the next day because of that? Well, a lot of my patients say yes to that, and it's really the face of this problem. And in this case, a lot of these folks have a bladder control problem, and we're calling it, and it's called overactive bladder. And again, it's one of the things we're talking about tonight. The good news is that there's a lot of treatment options available to people with bladder control problems. There's first line of defense, there's medicine and behavioral therapies, and we're going to actually talk also tonight about the Medtronic bladder control therapy, which has a test or evaluation, or step 1, and then device itself, which is step 2. Excuse me. Let's just look at the first line of defense first to your far left. At least my font isn't really large, but it's a compliment and a little bit of a criticism. Women cope a lot better than men. Now remember, men and women both have this problem, but women just live with this often because they cope so well. They're wearing pads, they're wearing, baggy dark clothing, they got a big purse, they have all these pads in it, where I think more men with incontinence just go and tell someone. I think patients really do live in silence because they're embarrassed. They feel it's a normal consequence of aging. They don't think there's really good treatments. But the common treatments are listed on this slide. I'm going to go over them in detail. But there's behavioral therapies, then there's medications, and there's treatments like the bladder control therapy device when the medications don't work. And we're going to address that. Let's sort of dive in now to the behavioral therapies. And I want to give you 3 fluid tips that we tell our patients. Very simple. If you're incontinent, drink about 5 or 6 glasses of fluid a day. Don't drink 10 or 12 because it's going to make your bladder work better, or you're trying to lose weight, let's say. It's 5 or 6. 2, don't drink a lot of irritants that irritate your bladder, make it more spastic, like Coca-Cola, basically sodas, alcohol, and coffee, basically everything I like. Excuse me. 3rd, don't dehydrate yourself because that's not healthy. The more concentrated urine is, it can make you urinate more often. Let's talk about a holding drill. A holding drill is when you resist the urge to go. I'm going to paint the picture to you. A patient said to me, I go, Scott, I void every 45 to 60 minutes. I can't sit through a 2-hour movie. My bladder just says I got to go all the time. I check the scale while they're emptying. They're emptying fine. What they have to understand at 45 to 60 minutes, they're having a bladder spasm, saying they have urgency. Their bladder is lying to them. They have to sit there and say, listen, this week I'm not going to go for an hour. So if I get a bladder spasm, I'm going to distract myself, and I'm going to count backwards from 100. I'm going to take deep breaths. I'm going to hold that contraction with my pelvic floor muscles, and let the spasm settle down. And every week I'm going to add 15 minutes to that and try to retrain my bladder to stop telling me at low volume I'm full. The pelvic floor exercises or the Kegel exercises work very well for cough, leaky, stress incontinence, but they actually work really well for overactive bladder as well, because when you're putting that key in the door, you can hold that urge, you don't leak. The medications, we'll mention that in a few moments. There's really two different types of medicines, but they're really bladder spasm medicines. They relax the balloon. Remember the balloon, so you're going less often, leaking less. So for the small percent of patients who are not emptying well, they may need catheterized. And then with the Medtronic bladder control therapy, believe it or not, it actually treats both. It's for overactive bladder when medicines don't work, but also helps people that don't empty well when medicines don't work, and we'll address that momentarily. Excuse me. So let's dive into lifestyle changes very briefly again, because little things can make a big difference to individual patients, but the bottom line is talk to your doctor about some of the medicines you may be taking. The biggest culprit is diuretics, the second biggest culprit is diuretics, and the third biggest culprit is diuretics. And many people need their fluid pills for their swollen ankles or for their heart, so please don't stop your diuretics. But they make you produce more urine. They don't cause the problem. It's just like drinking lots of coffee. They're just making you make a lot of urine. But talk to your doctor about it. Sometimes they can change the medicine or reduce the dosage. It's an important point. And then the bottom part of that slide, yeah, we've addressed some of it, but the bottom half is that if you lose weight and stop smoking, the data and clinical experience says that that can help bladder control problems. Okay? Excuse me, we mentioned medications. There's really two classes of drugs. The most common class is called anticholinergic. They relax the bladder. They block a chemical called acetylcholine that causes a spasm, and then they do work. They reduce spasms. They don't cure the condition. They control the symptoms by controlling the spasms. The most common side effect, I'm sure some of the folks tonight have been on them, are dry mouth and constipation. Sometimes they cause upset stomach. Sometimes they get into the brain and make you a little bit drowsy or foggy, but that's not that common. The AUA, that's my association, the Urologic Association, they define a patient who's refractory to medicine or fail medicine. If you fail one medicine and hopefully you try behavioral therapy, then you can be considered for more advanced treatments. Now, most doctors will try more than one medication, and yours probably has in clinical practice. So and again, the medicines, these are the bladder spasm medicines right here. I'm sure some of you have been on some of them. Some of them are generic. Some of them are now still what we call branded products. They're kind of hit and miss. They work differently in different patients. So you try one, it doesn't work, you try another. One gives you dry mouth or constipation, you throw it away and try another. In the middle of that slide, there's a new pill called Mirabetriq. It's called a beta-3 drug. It's also for the same problem, and it does help a lot of patients. But unfortunately, even with that long list that you see, the majority of patients don't reach their treatment goal with these medicines and behavioral therapy. They say they don't work well enough, they get side effects, they cost too much, or a combination of that. But the good news is that we have treatments for those patients, which segues into the next part of this talk, which is the bladder control therapy or InterStim device. And it's for patients who fail medical therapy. It's very common. I've been very fortunate to go to the head office of Medtronic and meet some of the smart folks that invent these things. And I kind of shake my head and say, thank you for inventing such a good treatment, because it really allows me to help a lot of patients. Excuse me. Now, what is the bladder control therapy? As you saw the video, medicines treat the symptom but not the underlying problem, which we think is a miscommunication in the nervous system between the bladder and the brain, and it's telling you to go all the time. It's lying to you that your bladder's full. This device is thought through gentle electrical stimulation. It sort of calms or corrects that miscommunication. The bladder settles down. You have less urgency, less frequency, and you're leaking less. The good news in the bottom bullet is this treatment is in 2 steps or stages, the first being a test or evaluation to see if it's going to work for you. When you think of the treatment, the Medtronic bladder control therapy or this InterStim device, it's for men and women. Doesn't matter what sex you're, but it's for people with overactive bladder or people not emptying blood, the retention patients when medicines fail, and that you've had a successful test or successful evaluation. So let's look at the evaluation, or what I call it the test stem, is it's really nice when a therapy, before you do it, you can test to see if you have a test or evaluate to see if it's actually going to help the patient, and the patient decides. This test is done usually in the office. Some folks do it in the operating room or outpatient center. It usually takes 20 minutes, sometimes 30, sometimes less than that, sometimes 10 or 15 minutes. The patient, fully awake, lays on his or her tummy. I'm in this room with Brenda, my nurse, with the patient, and one of the representatives from the company. I actually use an x-ray machine, but in the lower part of your back, just above the buttocks, 2 little leads. I use two thin wires are placed. There's no incision, just placed through the skin next to the nerves to go to the bladder. And then when we know it's in the right place, we put a little waterproof dressing on your lower back. We hook you up to a little computer about the size of the phone I'm holding, and you just wear some baggy clothes for about a week, and you walk around with it for about a week. Like a light switch, in about 70% of cases, let me say the majority of cases, the patient says, hey, this really helped. I may not be perfect, or I may be great, but this is really helping me, or I may just be fantastic. And that's the test. And then we just remove the 2 leads and put a little Band-Aid on. And most patients that they do well want to go on and have the device implanted. If a patient, I offered this twice today to 2 patients, and I really didn't go, I kind of go through the procedure like I just did with you, but I really don't talk about risk because they're really minimal for the test. Sometimes the wire can move and you think it didn't work because the wire just moved, but we really didn't know that, and it's called what we call a false negative. I guess sometimes the patients have a little bit of discomfort from the test, or maybe a little bit of red rash on their lower back, but it's really well tolerated, and it's easy to do. If you're feeling a little bit intimidated by this, having it done and explaining how to use a little handheld device and all the do's and don'ts after and all the restrictions, your nurse and doctor, you're pretty much on autopilot. They will teach you all about it. It's not very complicated. Now, what happens is when a patient, at least I would, when it works as a test, they say, well, look, I want to have this device, and they go on and have the bladder control therapy. But 150,000 patients have been treated since 1997, and there's really good data in clinical practice say this thing does work, it is safe, and there's really good data to say that when tested against medication, it actually works better than medication. They've had some really good studies on that I think are influenced physicians in their prescribing habits of this now. Excuse me. It says this is, the now of healthcare, or the new world is, how do I pay for this? Does Medicare or my insurance cover it? Well, the good news is the answer is yes. And Medicare case it covers it nationwide. Most insurance cover. I've not known of an insurance company in my practice that has never covered this. Sometimes there is a pre-authorization sometimes, but I think that's just part of surgery now. But it doesn't seem to be a problem, at least in my experience. Maybe the company can answer that as well. So let's just quickly go through some questions, and I'll sort of address them. I just had a peek at them before I came on today. Okay, these are questions from you. Why do you think most patients wait so long before seeking therapy? I'd say because I think they're, in a sense, normal, and I mean that I think they feel they're embarrassed. They think this is, so many people have it, maybe it's a normal consequence of aging or maybe being female, even though men have it as well. And they don't realize how many good treatments we have now. What can be done about encouraging speaking to your doctor? Just do it. We hear everything as doctors. We just do. And what I think you need to be, you tell them that your bladder's bothering them a lot, and even if they tried some treatments, really insist, say, look, this is really bothering me a lot, and if I really appreciate you trying to help me, and if you're not able to, is there someone else you could send me to that will address this? And just say it, and that'll get things moving. Trust me. Another question: I'm not incontinent, but I just basically leak urine all the time, and it just falls out slowly. I wonder if this would correct this problem. Well, I call this, when somebody's leaking, quote unquote, all the time, they have total incontinence. Dude, leaking, when you feel it, the pad's just wet. We call that leakage not associated with awareness. That's either from bladder spasms that you're not feeling, 2, a really leaky stem, or 3, overfull like the full glass. And this treatment treats 2 of those 3. It doesn't treat the leaky stem. It treats spasms. It treats not emptying well. But your doctor would have to do testing, et cetera, to see which one is you. Another question is, I had my prostate removed using the robot. It sounds like this patient is leaking with coughing, sneezing, bending. This is not for that condition. This is for bladder spasms. but about 40% of men that have had prostate cancer surgery have an element of bladder spasms. So sometimes these treatments do work, and these medicines do work in people who've had cancer surgery. Your doctor can sort through that, but if it's mainly due to leaky stem, that there's two treatments for that. One's called a male sling, and one's called an artificial sphincter. Excuse me. Let's go to the next question here. I want to make sure I don't take your time. How can you find if a bladder? Okay, it asks, I had a sling with a hysterectomy. Has it moved? I'm on these bladder spasm medicines causing side effects. Basically, we don't really know, does a sling move? If a sling didn't work, it means it's too loose. If it was working and all of a sudden it stopped working, something's changed. I think they can loosen a little bit, but you'll get a difference of opinion from different leaky bladder docs like me, but I don't think they move because there's no way of x-raying to know if they really have moved. You're having a lot of bladder spasms. That's why you're on that oxybutynin high dosage. You're having some side effects from it that look pretty significant to me. This is a great treatment for you. There's a lot of refractory therapies, or try some other medications if you haven't tried them. Excuse me. Let's see. I've had an urgent frequent bladder my entire life. Is InterStim a good treatment? I would say absolutely yes. You'd be the perfect candidate, great candidate for this type of treatment. I've been suffering for incontinence for almost 2 years, and they're not working. Basically, I'm on Flomax, called Tansilosin and finasteride. This gentleman is on prostate medicine, but if you have urgency and frequency and incontinence, those other medications and behavioral therapies and this device are treatments that are good for you. They all could work. Let's see. These are good questions. I've lived with bladder problems since the hysterectomy. That's when all the problems got worse. What's your suggestion? It's always the balloon. It's really hard to cause a problem with the hysterectomy. Nothing was done wrong, but a small percent of people do leak after a hysterectomy. They don't have the time to tell you why, but it's always the balloon. Is it leaky stem, loss of support, bladder spasms? Which one is it? It's the same therapies after that. I think the urinary retention is, this patient actually is getting up every 2 hours to divergency. I remember reading this question. Yes, when you have an overactive bladder, you get up frequently. You might feel you're not emptying well. That's actually part of the syndrome. And these treatments, we've just gone through them. That's overactive bladder in most cases. Male urgency, frequency, loss of control. We tend to blame the prostate initially. There's lots of prostate pills like that other man, but then you just treat them exactly the same. Men have overactive bladder. We do the InterStim device in them. We give them all those medicines. They're safe and they work well. Let's see. Natural remedies. This patient basically says, I've had enough, and this therapy, do you think it's good for me? And absolutely, there's treatments when medicines fail, and this is actually a really good one. It's actually, I don't usually say this to my patients, but it's actually what I would have if I had the problem. Let's see. This patient here had surgery to correct the bladder not emptying. This patient's on bladder spasm medicines, Mirabetriq and Detrol, and they're just tired of wetting the bed, and they've had this their entire life. Bedwetting in adults is bladder spasms, and almost in all cases, you're asleep, you have a spasm, and you leak, and yes, these treatments are for you. I'm embarrassed. This gentleman says, I'm really embarrassed. I'm leaking during intercourse. I got a lot of urgency, but I can't hold it. And I'm glad that, a lot of men and women do leak with intercourse. A lot of it's due to bladder spasm. It really affects quality of life. You can feel this gentleman's pain, and these are very good therapies for you. Okay, good. So we're almost done. If I was going to give you some tips, it may sound cliche, but talk to your doctor. But if he's not listening or she's not listening, just politely get another one. Just ask for another opinion and just do it nicely, because a lot of docs like myself love treating folks like yourself. That's a great website that gives you videos about how this treatment works, how it changes lives, testimonies. It's great answers to good questions, and they can even talk to what they call a patient ambassador, I think, who really walks you through his or her experience. This therapy is not perfect. Everyone responds differently, just like any other treatment, and it may not be right for you. These things aren't imperfect, but they certainly can help a lot of people. That's the phone number and the website again. And I think I'm almost done. It's very important to talk about safety anytime you talk to a doctor or a patient. This device is for overactive bladder, for urgency. It's for when you're not emptying your bladder well with retention, when medicines and behavioral therapies fail. You have to have that test to know if it works first. You don't give it in people that have a blocked bladder with their prostate. You don't give it to pregnant people or kids 16 and under, or they have neurological disease. There are side effects. Even a small percent get infected. Sometimes there's some discomfort with it. Sometimes the lead malfunctions. You're not supposed to have here. You can't have an MRI below your neck because there's metal in your body, and it would have to be removed if you needed the MRI. I just want to finish with a couple of things, and I hope I didn't take too much time. I want to cheerlead everyone, and it's almost how I started, that too many folks with this problem, men and women, live in silence. Speak to your doctor and set your goals high. Really get treatment, whether it's medicine, behavioral, some of these other treatments like the InterStim device. And I do also want to thank Medtronic and especially NAFC. When you look at that sort of their mission statement on that second slide, it's kind of like mine, I guess. Maybe that's why I like them so much. But they really, to me, are the voice of a lot of the folks that are probably listening on tonight. So thank you for having such programs. Thank you very much.
Great. Thank you so much, Dr. McDermott. We really appreciate you presenting today. And thanks, everybody, for joining us. Any questions that we didn't get a chance to answer live today will be forwarded to our Medtronic Bladder Control Therapy team, and we'll get back to you within the next probably 2 weeks. If you're interested in learning more about Medtronic Bladder Control Therapy, please visit our patient website at everydayfreedom.com, where you can search for a specialist in your area, or as Dr. McDermott mentioned, you can sign up to talk with somebody who is currently benefiting from our long-term therapy. Again, thank you so much for attending tonight. And if you have any questions, please email us at rs.everydayfreedom@medtronic.com if you have any further questions. Thank you so much. Good night.